Vigabatrin,
and epilepsy treatment.
by Rae'Miah James. What is GABA? GABA is an aminobutyric acid which functions as a primary inhibitor. A primary inhibitor, a neurotransmitter from the central nervous system. It functions to reduce neuron excitability by inhibiting neurotransmission. The GABA neurons are located within the hippocampus, thalamus, basal ganglia, hypothalamus, and brainstem. Essential for proper membrane stability and neurological function. Its major role is to control nerve cell hyperactivity associated with anxiety, stress, fear. They also helps with sleep as well. Mechanism of GABA. Mechanisms of GABA include it prevents chemical messages, and it decreases the stimulation of nerve cells in your brain. GABA carries messages from one nerve cell to the next. It has two types of receptors: GABA receptor A and GABA receptor B. The receptors binds if it GABA binds to the receptors, which decrease the responsiveness of the nerve cell. The precursor for glutamate is a precursor from glutamate. Its receptors respond when GABA released into the nerve terminal. Now you have GABA A, which is a ligand-gated ion channel. Has fast synaptic inhibition. Once bind, the ion pore opens up, allowing chloride to move across the membrane. It's also located in the central nervous system and has high concentrations in the limbic system and the retina. Mechanisms on GABA continue. Now we on to GABA B. GABA B is a G-coupled protein receptor, which is considered to be a slow synaptic inhibitor. Now, once GABA is bound to the receptor, potassium is increased within the membrane. Adenocyclase is activated, which prevents calcium entryway into inhibiting presynaptic release. GABA B is located in the thalamic pathways and cerebral cortex. It's a primary inhibitor transmitter. During embryonic development, GABA acts as an excitatory neurotransmitter. Proliferation of the neuron progenitor cells, and it has high levels of GABA in the ventricle areas. Just so you can see the picture. Now, what is vigabatrin? Vigabatrin is a drug that's used to treat refractory focal epilepsy in children 2 years of age or older and adults. It's also used for patients treated with other medications. So if one medication is not working, the doctor will prescribe vigabatrin to help it piggyback off of it. Now, it's an anticonvulsant. It increases GABA in the brain, which reduces the likelihood of seizures. The brand name is Sabril, which was FDA approved in 2009. Now, some side effects of this medication: color blindness, blurred vision, eye pain, loss of memory, problems with memory, and so forth. There's other effects that it happens as well with dealing with your vision. Now, the knockdown of GABA, vigabatrin, which prevents the seizures. Vigabatrin increases concentrations of GABA in the central nervous system. This inhibiting enzymes responsible for its metabolism to succinic semialdehyde, which is a gamma aminobutyric acid transaminase, also known as GABA T. Vigabatrin prevents metabolism of GABA. It inhibits enzymes responsible for GABA metabolism, and it also inhibits the mTOR signaling pathway, which is regulated off of mammalian metabolism. The structure of vigabatrin. This is the structure, as you can see. Now, just some other details about it. It inhibits GABA degrading enzymes, GABA transaminase, which increases GABA concentrations in the brain. It also increases in GABA functions as a brake, sort of say, on excitatory processes, which can initiate the seizure activity. So basically, so that's what it basically does. And then next that you have the next slide would be the works cited page, and I have, as you can see, I have all of my sites that I use for this PowerPoint presentation. Thank you.